Hello friends, welcome you all at Indian Institute of Learning Life Saving Skills to continuing with the emergency topic and triage topics. So today we are going to discuss about the most important topic is LOC. LOC is loss of consciousness. Okay. The moment the patient arrives in emergency department, tries anywhere with a loss of consciousness is an important task, and within 2 minutes we need to find out where exactly is the pathology. Within 2 minutes we have to assess complete patient from head to toe. We have to do the examination of the patient from head to toe. Examination we have to perform a patient within 2 minutes. So whenever the patient comes of a LOC, whether he is a pediatric patient, adult patient or geriatric, that shows means of any age group, whether it is a pediatric, adult or geriatric. Head to toe examination we have to perform within 2 minutes. The most important task, the immediately the patient arrives, we have to check for the pulse. Yeah. Pulse is the most important factor in an unconscious patient. If pulse is absent, or pulse is present. So first we take the algorithm of pulse is present. Pulse is absent. Let us say pulse is absent. Pulse absent, loss of consciousness, and then you have to check for the response. And if there is a no response, patient is not responding, pulse is absent, loss of consciousness. Loss of consciousness patient always brought in an emergency department with an stretcher. आप देखेंगे कभी भी पेशेंट कैसे आता है, स्ट्रेचर पे आता है, व्हील चेयर पे नहीं आएगा अनकॉन्शियस पेशेंट, बिकॉज इट इज डिफिकल्ट टू carry. The patient always brought by someone in a hand, if a pediatric patient or a low weight patient, and otherwise they will be brought in emergency department with stretcher. अगर आप emergency department में ट्राइज में emergency में बैठे हैं तो आप देख सकते हैं, स्क्रीन कर सकते हैं आपकी विंडो से, या somebody is brought in and stretcher. Most probably there might be patient is in loss of consciousness. One thing. Second, immediately the patient arrives, you have to take the universal precautions. हमें लेनी है universal precautions patient को examine करने से पहले. That is double gloves अगर trauma का patient है तो, otherwise single gloves we can use, because we don't know patient might be having some contagious or some blood flow on the blood will be sprinkle over the body, that kind of things will be there. So first initial assessment we have to do by the pulse is present or not. Pulse is absent, no response, so this completes the triad of cardiac arrest. Yes, this completes the triad of cardiac arrest. I'll start once more, repeat once more. Loss of consciousness, pulse negative, and no response. This is the triad of cardiac arrest. Immediately if this happens, we have to announce the code blue. We have to announce what? We have to announce code blue. Immediately we have to announce code blue and start the resuscitation of the patient. We have to immediately start the resuscitation of the patient. Immediately we have to start resuscitation of the patient. Immediately we have to start the resuscitation of the patient. Immediately, code blue. Okay. So that shows the importance of absent pulse. Pulse is not there. Then cardiac arrest, follow the code blue, and we have to follow the resuscitation pattern immediately. Suppose if it is pulse is present, then you have to look for the response. Then about the vitals, that plays a most important role. We have to look for the 5 vitals. We have to look for the 5 things. One is pulse, blood pressure, SpO2, temperature, and respiratory rate. These are the 5 vitals. Suppose patient is unconscious state, pulse is present, immediately this we are doing in a span of just 30 seconds only. Then pulse is present, vitals, we have to look for the BP. Suppose here blood pressure is 220 by 140 mm of Hg. Immediately unconscious patient, pulse is present, patient is not responding or drowsy or arousable with low GCS, BP is on higher side, 220 by 140. Immediately we have to get it done. What? Immediately we have to get it done NCCT head. What we have to get it done? NCCT head. There might be patient is having IC bleed. Their patient might be having intracranial bleed. Immediately we have to look at this scenario. So this scenario completed. Loss of consciousness, pulse absent, no response, cardiac arrest, announce code blue. and do the resuscitation as soon as patient arrives within 30 seconds. Then response, no response plus or minus, whether it is present or negative. Then vitals we have to look it for. Then check the BP. If BP is on higher side, let us say accelerated hypertension more than 220/140, then we have to get it done immediately NCCT head, non-contrast CT scan of the head. It ruled out to NC bleed, the most important. Either there is a bleed or either there is a infarct. But in the initial state, what happens in a infarct patients, usually CT will come negative. Negative means negative for the bleed. It doesn't mean there is a no intracranial pathology or there is a no cerebrovascular any pathology or cerebrovascular insult is not there. That is most important. We need to rule it out immediately. Just we can do it within 2 minutes. Now we'll expand further. We expand it further. Let us by say pulse is present. Now we have to look for BP on higher side. And here BP on lower side. Okay, pulse present, patient is unconscious, BP on higher side. We have to immediately get it done, NCCT head. Immediately screen the NCCT head of the patient, and we need to get it done what? We have to suspect for either there is a IC bleed or either there is a cerebrovascular accident, that is ischemia. That might be evident after 4 hours in MRI, that is diffusion weighted images. After 4 hours it is evident. First 4 hours, within 4 hours the CT scan becomes negative, and in MRI it takes time. To develop ischemic penumbra. The most important part is ischemic penumbra. Remember that word, ischemic penumbra. We need to rule out. If BP is on lower side, pulse is present, always look for the causes which can give rise to this. Means there might be patient is in the shock condition. When BP is on higher side, look at the pulse. BP higher side, pulse on lower side, let us say bradycardia. So this shows there might be intracranial bleed leading to Cushing reflex. Cushing reflex says that the triad of what? Hypertension, bradycardia and irregular respiration that usually found in hypertension, bradycardia, irregular respiration that usually found in intracranial raised ICP signs. That might be because of some tumor, that might be because of SH, that might be because of intracranial bleed. There might be n number of pathologies. So this happens in BP on higher side and pulse on lower side. BP lower side but pulse on higher side. That is called as compensatory tachycardia. Usually found in the shock. Then we need to look at for the history. History plays an important role. Whether there is a patient is having history of trauma, then chest injury, abdominal injury, we need to screen it out immediately. Tension pneumothorax, then retroperitoneal bleed, pelvis fracture, long bone fracture. Immediately we need to rule it out and try to stabilize the patient as soon as possible by starting the crystalloid shot first. Crystalloid we need to transfuse, that we'll discuss in the next class. First we are just evaluating within 2 minutes loss of consciousness. Then pulse is on higher side, then immediately BP on lower side. We have to look for cardiogenic shock or cardiac pathology, or we need to get it done the signs types of shock. So first immediately we have to get it done ECG. Patient is having either is in the myocardial infarction, cardiogenic shock, DCMP, that kind of conditions. Then we have to immediately look for some other reasons of history. History plays a most important role. Always in investigation of loss of consciousness, CT must be done to find out any. Even patient is having BP on lower side, there will be chances of bleed. Don't even think that BP ज़्यादा रहेगा तो ही patient को bleed होगा. We have seen n number of patients, BP सिर्फ 110 या 116 या 120 है और patient को bleed है, unconscious है patient. So always clinical correlation with the investigation plays a pivotal role, not only your clinical examination. So you have to concentrate on the both parameters. So, but if BP is on lower side and pulse is on higher side, relative bradycardia always go in hand to hand with the shock. That is compensatory phenomena that happens. Okay. So this we need to rule out. Then we have to get it done immediately. Patient might be in acidosis, respiratory alkalosis. So one by one each vital we are taking. Then we have to check immediately for what? immediately we have to check for pulse, SpO2. Immediately we have to check for SpO2. If SpO2 is on lower side, immediately we have to get it an ABG. Then again in ABG we have to look for 5 parameters. One is your pH, PaO2, PaCO2, anion gap, then bicarbonate levels. Okay, then 1, 2, 3, 4, and then you have to look for what? Lactates, lactate levels. That is the signs of shock. Immediately we have to get it done. To find out any respiratory problem, then correlate with this with the respiratory. Sometimes patient is in the type 2 respiratory failure because of COPD, CO2 retention. Patient might be behaving is in loss of consciousness. That patient requires immediately the airway management, that is intubation or airway management, or we need to patient put on mechanical ventilation support. Immediately we will get it done. This, suppose if all these things are, you are not finding anything, then we have to suspect for poisoning. Yes, then we have to suspect for poisoning, the most important part. Patient is in poisoning, then we have to look for the poisoning. One thing most important, any history of poisoning, sudden onset. Okay, then if patient is having all these signs, vitals are even pulse is present, BP is on normal side, patient is having loss of consciousness, low GCS, that is 7/15. Okay, then let us say if it is on lower side, then we need to do what? We need to look at for the other things which plays a most important role. 12. So there might be any chances of strangulation, then you have to check for the neck signs. Any strangulation history or hanging, these kind of things, immediately we have to look it upon in these kind of patients. Okay, then most important, we have to check for blood glucose of the patient. Blood glucose, if blood glucose in on higher side more than 500, let us say, immediately get it on ketone or blood for acetone, urine for acetone or urine for ketone, to rule out patient is having diabetic ketoacidosis. Diabetic ketoacidosis. If patient is sugar levels are more than 800 or more than 1000, more than 800, more than 1000, but ketones are negative, urinary ketones are negative, then this condition is called as HONK. Hyperosmolar non-ketotic coma, HONK, H-O-N-K, or HHS, hyperosmolar hyperglycemic syndrome, HHS, hyperglycemic syndrome. So this is how within 2 minutes we can evaluate any patient who comes in emergency department with a patient of loss of consciousness. The most deciding factor is pulse. If pulse is absent, go for cardiac arrest protocol. If pulse is present, look at the vitals. Vitals gives you a clue. SpO2, BP on very higher side, it might be bleed. BP on very lower side, it might be because of shock or trauma. Patient is bleeding, may not be evident outside even a drop of blood. There might be patient losing liters of blood inside. Okay, then we have to immediately get it done. Sugar, ABG, sodium potassium of the patient, electrolyte sometimes comes in the ABG, or you can ask for the then lactate level to rule out the shock, then importance of CT, importance of ECG. So this is about how we will evaluate the patient in 2 minutes of loss of consciousness. Now the most important thing is what investigation we immediately can get it done. See, there are two things. One thing is you can do is random blood sugar or your serum monitoring blood glucose. Immediately you can get it done your blood glucose by what? Glucometer. Glucometer you can get it done. Then you can get it done what? ABG. It will come immediately. It depends whether it is available in your institute or not. Then sodium potassium. Then most important you can get it done is ECG, basic investigation. Then you can go up to NCCT head. The most important things. Okay. The most important. Then pulse is absent. Code blue scenario. Cardiac arrest. But if you are suspecting patient of IC bleed, BP is on very higher side, but if no CT scan present, no CT scan at your institute, please don't use any antiplatelet, any thrombolizing agent just on your clinical assessment, because nobody in the universe on this planet can just say that this patient is having bleed, this patient is having infarct. It is the only gold standard to deciding factor is NCCT head. If we are using any thrombolytic agents, any drugs, aspirin or heparin or whatever, without doing the CT scan, then it is not at all acceptable by any person, because there is nobody in the world which can find out that this patient is having bleed. Even the patient who is BP on higher side, it might be because of relatively ischemic penumbra की management के लिए कई बार BP shoot up करता है. That is because of what? That is because of the patient is having the cerebrovascular accident, that is ischemic insult. Cerebrovascular accident में दोनों चीजें आती हैं, bleed भी और ischemia भी. That is because of ischemia. And second most important part is that it happens because of patient is having BP on lower side. SH का patient है, एकदम से bleed हुआ, SH एन्यूरिज्म रप्चर हुआ या एन्यूरिज्म रप्चर हुआ या सबआर्कनॉइड हेमोरेज हुआ, पेशेंट को बीपी एकदम हायर साइड था, हॉस्पिटल पहुंचा, तब तक पेशेंट का बीपी सब ऑप्टिमल है. डोंट गिव इकोस्प्रिन ब्लाइंडली, इवन द पेशेंट इज एम्बुलेटिंग अलोन. सेकंड मोस्ट इंपॉर्टेंट, पेशेंट का बीपी लोअर साइड है, पेशेंट का बीपी 90 है या 100 है, डोंट इवन कंसिडर और presume in emergency that this might be the scenario, because your small step initiative in the treatment protocol can change the entire pathology and worsen the patient condition. So thank you very much. Keep connected with Indian Institute of Learning Life-Saving Skills to evaluate the patient in LOC within 2 minutes. Next class we will be discussing in more detail about the each and every factor. Thank you very much.
Papa.